Sun Life Financial is proud to host this roundtable on healthy workplace cultures in partnership with the HR Reporter. It's part of our thought leadership platform, The Conversation, which brings together leaders and experts to deliver the best thinking in group benefits both inside and outside our organization.
With an aging population, more treatable diseases, and a growing number of specialty drugs, drug plans in Canada are seeing dramatically rising costs. Canadian HR Reporter recently moderated a roundtable sponsored by Sun Life Financial that brought together several experts to discuss the challenges and possible solutions, looking at issues such as how these plans have evolved, innovation in medicine and technology, the benefits of targeted treatments, the growth of chronic diseases, evidence-based drug plans and tiered formularies, generic substitutions, and employee preferences. In this video, the third of a three-part series, panelists talk about the employee factor when it comes to employer drug plans, including the importance of communication, flex plans, wellness programs, and employee preferences.
And more employers are recognizing that when you look at the cost of your benefit plan, the top 10 conditions are usually chronic conditions, preventable conditions. So with diabetes and cholesterol, etc. So, there is an investment or an ROI from an employer side to put wellness programs at the forefront and help educate employees to take a vested interest into their health. Now, that being said, very difficult. Those that do, to your point, do, and they will continually invest in their health. It's reaching those that it's just not top of mind. And as an employer, we struggle to reach those employees and get them to, not for their well-being, for being fit at work and well at work, but also on the cost of the benefit plan, which is a trickle effect.
I was going to say, one of the things we're trying to do is also embed more of that in our culture. So more recently, we've had global fitness challenges where, we're having employees around the world participate and sort of build that into the culture, have that more as team building. So trying to find innovative ways to engage employees in that wellness approach is something we're focused on.
Certainly with the population that we have in Canada and with the U.S. parent, again, to your comment, there's certainly a lot more things that happen in the U.S. in terms of health and wellness, bigger initiatives driven by how their drug programs are set up. We certainly have different locations of where we are doing business, so it's important to look at the employee value proposition in that location. We may overall say for Bridgestone Canada, these are certain things that we want to have as part of our package, total rewards to give to the teammate, but does that make sense? And how do we balance that out to have a healthy workforce? If we look at all of the communication and conversation that's happening around mental health in the workplace, you have a healthy workplace. So what types of things are we trying to do or could we do that brings that into the package as well to help people stay well?
For us, we move, it's been moving to generics, moving to formularies, prior authorization, and it definitely has required good communication, but I have not found that transition to be a difficult one for our employees. But we've recently engaged in discussions around pharmacy networks, and I think we're looking for more innovative ways to do that and what other employers are doing. And with benefits, it's one of those areas where, at least for us, it's a key part of the total rewards package. We need to be competitive. We want to provide our employees with what is needed, which can be difficult given that spectrum. But it's not necessarily an area we're always at the forefront or trying to lead with. We're tending to, I think it tends to be an area where it's sort of what are most employers gravitating to, and I think we're looking for those kind of innovations from an employer standpoint.
So I think there's more and more evidence about the benefit of these modifications, which are tied up into wellness programs and the value they can have to offset the costs on the drug side. So really looking at it, and it sounds like we're all looking at it from that holistic view on there is the drug expenditures, but what can we do even before we get to the drugs, which is also a big mindset shift that's happening, I would say, of late. So in the presence sphere of management, as in the past there was the advent of the drug card and what can we do to manage drugs. Now it's how do we even manage the cost before they're on drugs, or if they're on drugs, how do we prevent them from doses escalating and so forth.
It's a bit of a challenge right now as we're talking to employers who are more and more looking at what is the right amount of money to be spending on this? What's the right cost? Is balancing what employees want with what employees need. And so what I mean by that is there's a number of things that have worked their way into our medical and healthcare plans over the years, which are really cash flow expenses, vision care plans, some of the things that are much lower cost, predictable expenses, dental recalls. There's a lot of things that are in the plan today that really don't provide insurance protection. They provide cash flow management. On the other side, so those are the things that employees see every day and they really want because they're front and center. But then there's the side of, well, what they actually need, the coverage for catastrophic drugs. We'll talk a lot more about biologics and the cost of some of those. That's where people really need the insurance protection. So as an employer, you've sort of got this balance you're trying to achieve of that risk that you want your employees to be covered for, but that's not what they're asking for. They're asking for this day-to-day coverage that they want their expenses reimbursed for. How do you balance those two and provide something that is going to attract employees, but it's also going to provide them with that insurance that they need? This was actually called medical insurance at one point. Mm-hmm. We've kind of gotten away from that insurance element to a large degree. I think we're moving back to it to a lesser degree.